Hi everyone, I think now we were in end of brain stimulation topic. That is the last classification now we are going to discuss, that is deep brain stimulation. So deep brain stimulation is one kind of the surgical procedure as like a vagus nerve stimulation. Here also we are going to use the electricity in order to directly stimulate the sides of the brain. Okay, so the main aim of the DBS, okay, deep brain stimulation, is used to treat severe OCD or the depression in the patients who they are not responded to the other treatments. So, and not only that, the people having some sort of movement problem also, they can go with this deep brain stimulation. Okay, one such problem is that Parkinson disease tremor. So deep brain stimulation is a non-invasive method. It's used to treat severe OCD, depression, and the Parkinson disease, that is a movement-related disorders. So what are the side effects of this type of DBS is that here also we have to carry out some sort of brain surgery like vagus nerve. So the people will have some sort of bleeding in the brain while doing some surgery or after implanting the device, so that may lead to some stroke kind of thing. And the device, that implanted device, may lead to some discomfort or the pain, or there is a chance to get the infection also. And the infection near the, as I said before, there may be some infection near the incision site. Other people may feel some feel experience of headaches, a disorientation of their body, or confusion. They have been mentally may depressed, cognitive impairment. They may feel some tiredness, dizziness, nausea, or vomiting. So this is like unavoidable thing. Okay, the side effects is the unavoidable thing. You can see in any type of brain stimulation, you can feel some sort of side effects. Yes, the deep brain stimulation also have some sorts of side effects. So next we will see how we are going to do this particular DBS. So before doing into surgery, yes, it is involved in the brain surgery. So before going to that, we have to give anesthesia in order to numb with particular area of the brain. Then we have to do the drill, or one or two small holes we have to put on the head in order to send the insulated wire to reach the targeted area, and also place the electrodes in the specific brain area. And other end of the electrodes will be connected to the generators. Okay, so the patient will be in awake when the electrodes are implanted to provide the feedback on their placement, but does not feel pain because we have given the anesthesia. After the electrodes are implanted, the patient is put under the general anesthesia. The electrodes then attach the wire, then run inside the body from the head through the neck, shoulder, and down to the chest, where the battery operated generator will be phased, as like we discussed in vagus nerve. The generator is then upper chest, whereas the early DBS devices used two pulse generators, one wire to each implanted device, and the most new devices use single pulse generator to stimulate the both electrodes. So these are the difference between how many electrodes you are using it. Okay, or how many pulse generator you are using it. So during the procedure, the patient may be given a device-based tool like a handheld controller or smartphone app. They can witness their body activity, and they can manage their symptoms at home, and to provide the feedback to the they can provide the feedback to their care team also. This is almost similar like a vagus nerve treatment. So here also we are doing some sort of surgery in order to place the electrodes directly to the brain, and other thing is a pulse generator that we place under the chest. So this is the procedure that we discussed now. So not only this, limited to this particular classification, we have other set of classification also. We have related to brain stimulation treatment, that is temporal interference, transcranial alternating current stimulation, transcranial direct current stimulation, and transcranial random noise stimulation, and last transcranial ultrasound stimulation. So with this, I am going to wind up this brain stimulation treatment topic, followed by just we will look at out a small student activity related to this particular topic, and enjoy the video. Thank you.
Hello guys, today let's see a topic on puzzle on brain stimulation. Okay, first I will solve. A non-invasive brain stimulation technique that uses magnetic field to stimulate nerve cells. It is TMS.
Second one, the implanted device that delivers electrical impulses to specific parts of
This is our next type of brain stimulation of 10 used to treat Parkinson's disease. It is FES.
Then next fourth question, a technique that uses direct electrical currents to stimulate parts of the brain, and that is TDCS.
Okay. This type of brain stimulation is commonly used in treating major depressive disorder. It is ECT.
And the sixth question, a neurotransmitter often targeted by brain stimulation techniques for its role in mood regulation, and that is serotonin.
Technique using ultrasound waves to stimulate brain activity. It is FES.
And then eighth one, a term describing the ability of the brain to reorganize itself by forming new neural connections, and that is neuroplasticity. Then to the ninth, a type of non-invasive brain stimulation that uses alternating currents. It is PACS.
A brain region involved in movement, often targeted by deep brain stimulation, is thalamus. Okay, thank you. Let's see some other.